Govind, good afternoon. Well, the country's eyes are on the capital as we anticipate a consolidated plan from government that will map out how South Africa is going to weather the storm or the fallout, the social, the economic and the health fallout of COVID-19. The question that I guess you'll be interrogating and unpacking as well for us is just how many struggling or dysfunctional municipalities are going to be able to implement this plan that will be put forward by government.
Indeed, whatever plans are consolidated and agreed on here at this urgent cabinet meeting, which was called by the President, will have to filter down to the different levels of government. We're joining you now from the Union Buildings here in Pretoria, where the President has called that meeting not only to get the consolidated presentations from his different ministers regarding the government's response to the COVID-19 outbreak, but also to get a clearer picture of what it looks like at the moment. We know that at least 1,500 people have been tested by the health department, and of that 1,551 of them have confirmed to have the coronavirus. But we also know that there are different sectors of society that are panicking at the moment. There are big questions being asked about whether or not we should be conducting mass testing and whether we have the capacity to do so, and whether schools should be closed. At the moment, it seems the decision on schools would be rash, and we really need to hear from the Minister of Education on whether or not the coronavirus does affect pupils of which age. But there is a consensus that mass testing does need to happen. In other countries where it's happened, we've seen the rate of infection flatline because of the proactive response taken by the government, and that's what South Africans are looking for here, for the government to take decisive action, and that's of course what we hope the President will be announcing after the special sitting. But I'm joined here by political analyst and ENCA anchor Karima Brown to talk a little bit about the President's priorities, his need to take decisive leadership, but whether we'll see any of it filtering down to the local government level. Karima, let's begin in the capital city of Tshwane, which is currently under a process of administration. It's the headquarters to the second most number of embassies in the world after London, and it's a city where we don't know if the government's plans to fight the coronavirus will be implemented at a local scale. It's a dangerous mix that really provides a cocktail of risk at the moment, doesn't it?
You hit the nail on the head, Govind. It is a city that is rudderless, it is leaderless, it doesn't have an executive mayor. So it doesn't matter what the President announces later on in the day. How is Tshwane going to be implementing it? If you look at the services that are likely to be affected, the changes that need to be made, you need to do it where the tire hits the tower, and that's municipalities. And here you have the administrative capital, Tshwane, not being able to cohere. So what is going to be required, the first order of business in Tshwane, is that you're going to have a municipal government that is legitimate, that can function, and that can actually deal with the disease as soon as possible.
And we look at other cities as well, such as the Western Cape, where there is a different government in power, and cities like Nelson Mandela Bay, where there is a coalition council in power. How do you think the dynamics between these different parties would affect the government's ability to implement their response efficiently?
On paper, Govind, we have what is called cooperative governance, right? And we have what is called concurrent power. So you would have things like education and health, you have national competencies, and you have provincial competencies. But what we've often seen, if you look at how the government has responded to other crises, let's say the gangs in Cape Town, there's been this political football between provincial and national governments when the province is run by a different party to the national government that is run by the governing party. And what I'm hoping is that the political leaderships of the different parties put their brinkmanship aside, because we cannot afford for the politicians to bicker with each other at this point in time. We have to agree on very important things. If you look at a place like Gauteng, for example, it has the highest number of cases so far. We have an administrative capital that doesn't have a government. We have the city of Johannesburg, the richest one in the continent, that barely manages to function after the coalition government came to halt. And then, of course, Nelson Mandela Bay, the psychological heartland, if you like, of the governing party, also in a mess. So we are expecting, South Africans, I think, are expecting that their political leaders across parties need to cooperate, and that the President needs to lead. And I think the responsibility is going to fall on all these councils to cohere as quickly as possible, to be able to have instruments through which they can put the plans into place.
Lastly then, Karima, a question that we touched on earlier was all of this is going to require massive amounts of money. We've seen some donations coming in from countries such as Germany. But as these things stand, do you think there's room to get that the other money that's short, or is it available?
Well, I have been speaking to people in the Treasury, and from Friday onward, I know that Treasury officials have been looking at the cost of testing kits. But as you know, we have already got a shortfall. We had a very, very difficult budget with growth forecasts downgraded, and of course also that public sector wage cut. So we are in a very tight spot. So I think monies are going to have to be raised from foreign countries, but also I think from our business community. And of course, we have to look at redirecting and reprioritizing some of the budgets to deal with this health crisis as it stands.
Thank you so much. That's Karima Brown, a political analyst and anchor of The Fix.